Excellencies, dear colleagues and friends, and Dr. Yassin Arabi, all protocols observed. Thank you for inviting me and my colleagues to this very important meeting. As you know, COVID-19 is the greatest global shock in decades, causing major disruptions to health systems, economies, and societies. The impact of the COVID-19 pandemic goes far beyond the disease itself. And just as we collectively face a global threat, so too must we work together in our response, following the principles of multilateralism. We must recognize that this challenge is much larger than the health sector alone, and that we must work across traditional silos with the whole of society, whole of government response. Let me start with a brief summary of the current situation. More than 7.7 million cases of COVID-19 have now been reported to WHO, and more than 430,000 deaths. Although the situation in Europe is improving, at the global level, it's getting worse. It took more than 2 months for the first 100,000 cases to be reported. For the past 2 weeks, more than 100,000 new cases have been reported almost every single day. Almost 75% of the recent cases come from 10 countries, mostly in the Americas and South Asia. However, we also see increasing numbers of cases in Africa, Eastern Europe, and Central Asia. At the same time, we're encouraged that some countries around the world are seeing positive signs and starting to ease the so-called lockdown restrictions. In those countries, the biggest threat now is complacency. Studies show that most people are still susceptible to infection. Without proper safeguards and monitoring, a resurgence is a real threat. Countries must continue with active surveillance to ensure the virus does not rebound, especially as mass gatherings of all kinds are starting to resume. So-called lockdown measures have been successful in suppressing transmission. To actually stop transmission, countries must take a comprehensive approach: find, isolate, test, and care for every case, and trace and quarantine every contact. As the pandemic accelerates in low and middle income countries, WHO is especially concerned about its effect on people who already struggle to access health services, often women, children, and adolescents. It's unraveling many of the gains we have made fighting some of the world's most devastating diseases. Vaccination campaigns for polio, cholera, measles, meningitis, and HPV have been disrupted, putting hundreds of millions of people at risk. Additionally, 80 million children are at risk of missing out on routine vaccines for tuberculosis, pneumonia, and diarrhea. There is also a real danger that the COVID-19 pandemic will be followed by a hunger crisis. The World Food Programme estimates that the number of people in low and middle income countries facing acute food insecurity will nearly double to 265 million by the end of 2020. Just as the effects of the pandemic touch every sector, so WHO has worked across sectors to create new partnerships. One of the most important of this is the Access to COVID-19 Tools Accelerator to scale up development, production, and equitable distribution of vaccines, diagnostics, and therapeutics. We also established the COVID-19 Technology Access Pool, a voluntary mechanism through which we're inviting companies or governments to develop an effective vaccine or therapeutic to contribute to the patent of the medicines and also the rest. Another example is COVID-19 Partners Platform, which is kind of matchmaking tool for countries. The Partners Platform enables countries to enter planned activities for which they need support and allows donors to match their contributions to these activities. So far, 105 national plans have been uploaded and 56 donors have entered their contributions, totaling US $3.9 billion. The platform also includes the COVID-19 supply portal, enabling countries to request critical supplies of diagnostics, protective equipment, and other essential medical provisions. WHO is now in the process of shipping more than 129 million items of personal protective equipment to 126 countries. Even as we focus on responding to the pandemic, we must also be planning for the recovery. There is a growing realization around the world that in so many areas, we cannot afford to go back to the way things were. It's critical that we learn the lessons from the COVID-19 pandemic, which remind us once again that we're only as strong as the weakest link. Excellencies, dear colleagues and friends, let me leave you with 3 areas where I believe the leadership of the G20 is vital. First, the most potent tools in the fight against COVID-19 are national unity and global solidarity. No organization and no country can fight this pandemic alone. Only by working together will we overcome this global threat. The greatest threat we face now is not the virus itself. It is the absence of global solidarity and global leadership. We cannot defeat this pandemic with a divided world. The G20 is a vital forum for strengthening international cooperation, and I thank the T20 for your leadership in bringing together thought leaders in many areas to provide the G20 with strategic policy advice. And I would also like to thank and appreciate the leadership of the Kingdom of Saudi Arabia. Second, the pandemic has underlined the critical link between global health security and the local health systems. We need to invest even more in strengthening health systems and improving resilience, particularly in those countries and communities with weaker health systems. Third, we need to build back better. We cannot afford repeated disasters on the scale of COVID-19, whether they are triggered by the next pandemic or from mounting environmental damage and climate change. Attempting to save money by neglecting environmental protection, emergency preparedness, health systems, and social safety nets has proven to be a false economy. The bill is now being paid many times over. It's an old public health dictum that the most expensive thing of all is to do nothing. Unfortunately, we're still learning this lesson. Ultimately, preparedness and strong health systems are not a cost. They're an investment in a healthier, safer, fairer world. Thank you once again for your leadership and partnership. Shukran jazilan, the Kingdom of Saudi Arabia, for your leadership, and I wish you a productive discussion. Again, shukran jazilan.